Hello, everyone, and welcome to the Cannabis Alliance's Webinar Wednesday. I'm excited to be hosting today a conversation with a panel of experts about decoding 1453, the medical tax exemption House bill that was passed this year that is creating quite a stir, and I think it needs a lot of support. So we're hoping to be a part of that today. My name is Jessica Pichardo. I'm the Vice President of the Board here at the Cannabis Alliance, where we're dedicated to the advancement of a vital, ethical, equitable, and sustainable cannabis industry. We're really excited to have everyone here today. I'd like to start by doing some introductions from all of our panelists, and then we can get started on a conversation that hopefully will lead to resources and support around 1453 today. Mostly for those folks that are actually out in the community talking to people about it, MCCs, frontline staff, folks in the stores. So that's where we're going to be focused today. So thanks again, everyone, for joining us. I'd love to start introductions, and I'm just going to point Angela.
Hi, I am Angela Williams. I am a medical cannabis consultant with Skagit Organics. I have been in the industry since 2011. I've been with Skagit since day one. We are super patient focused. And so I am a cannabis educator. I am a patient and a member of the Education Outreach Committee member, and I am very excited to be here.
Thank you. Charlotte.
Sorry, everybody. Trouble unmuting. Hi, everybody. I'm Charlotte Lauder-Brathwaite. I'm the head baker at the Bakersman Collective, a cannabis lifestyle brand. I'm also an MCC at Remedy to Layla and bud tender, and I'm definitely a patient. So happy to meet you.
Thank you. Lorelei?
Hi, I'm Lorelei Walker. I am the program manager at the Department of Health's Medical Cannabis Program. Been in this position just about a year now, although I've been with the department for more than 15 years. Thanks for having us today.
Thank you for being here. TJ.
Hey, everybody. My name is TJ Johnson with the Medical Cannabis Program. I'm a microbiologist. I've been with Department of Health for 9 years now, a little over 9 years. I've been with Medical Cannabis Program now for almost a year. Very happy to be here. Thank you.
Shannon.
Hello, I'm Shannon Engel and the Deputy Director of Drug Systems, which houses the Medical Cannabis Program. I've been with Department of Health for a little over 2 years now, and prior to that, worked with the Liquor and Cannabis Board in the licensing division. And excited to be here and listen and hear all the questions that come. So thank you for having us.
Thank you. And Johnny.
Hi, everyone. I'm Johnny Wong. I am a chemist for the Medical Cannabis Program. I've been in this position for about a year. Before that, I've been in the cannabis testing space for about 5 years. Thank you, everyone, for showing up. I really love listening to stories and listening to people. So thank you.
Thank you. All right. Well, as you can tell, we're in it to give a lot of great information today from a lot of great folks who are, really working in and around 1453. This number has been tossed left and right, but there's those of us who are working in it day to day. And so I'd love to start first with just giving a bit of an outline of what this really meant for Washingtonians and what this change is kind of ushering in. The first thing being a lot of talk around patients. Medical cannabis patients. There's been a bit of a pause on support and talk for them for quite a long time. And so I feel like this has ushered in more conversation and support in product offerings, hopefully soon, and support from places like DOH focused on just them. So 1453 essentially takes away or eliminates the patient excise tax of 37%, or sales tax, patient excise tax, 37% for patients that are registered in the state database through the Department of Health. And so I think a great place to start would be a little bit about maybe acknowledging the swift change that this is for retailers and producer processors. We know that in this industry, you have to adapt very quickly. And so I want to just start by recognizing that I think there's can be frustrations around how swift all of us need to figure out frameworks to support the patient. So I'd like to first focus on asking maybe the MCCs how you think this 1453 change is supporting the patient, or what do you think the approach is here, and how can this better the engagement that they have with the cannabis community? Either Angela or Charlotte, if you're open to answering. Go ahead, Lotta.
Oh, sorry. I think we were like, who jumps first? In this situation, I think it better supports patients because being taxed on your medicine is just unreasonable. So a little bit of savings for something that you are dependent upon is a great impact. The consumers that I see that are patients, they don't have a ton of wealth, but they're in there every day. They're spending a large portion of their budget to get this medicine because it makes daily living easier for them. So, yeah, at the end of the day, more money back into their pockets.
I completely agree with that. I'm a little different than Lotta because I'm not in the actual retail space a lot of the time. So for me, because we do patient consulting through our sister company, Skagit Wellness. And so I would go ahead and say probably 70% of the patients that we work with are on a fixed income. And so this is absolutely huge. I mean, huge. When I was calling them and letting them know, there were lots of tears. Because in some instances, they would either have to choose between their medicine or food. And this is just absolutely amazing.
I appreciate hearing the perspective both from in and out of the stores. I think a lot of what is happening right now is a lot of question marks or sort of made up concerns that 1453 will usher in maybe misuse in the medical market. And I'm kind of getting the feeling that you're not seeing that or not concerned about that. Angela, could you talk a bit about, the patients that you are supporting and have been supporting long before this change has been coming?
Yes. So speaking as myself as a patient, so there was a period where when medical went away and rec came into play, right? I didn't re-up my card. So the switch between then, where essentially it was very, very loose to get an authorization, to where I literally had to have 6 months of my medical record showing that my course of care was not working. And so that cannabis was the next best thing for me because it had worked in the past. That's what I had to do to get my authorization from my physician. So it is not that easy. And it really bothers me when that comes up and it's like, oh, it's going to be like back in the day when everybody could get their authorization. No big deal. It is a big deal. And in my experience, I had to really dig in and get all of the things before I could get my authorization. So I don't see that at all.
And please.
I was just going to say that I do see that concern being raised on the retailer's side. And that's, I think, a bit because of, in my situation, just in our last month or so of operating as a medically endorsed shop, I've seen a couple of not necessarily legal medical authorization forms come through and have to deny an endorsement card to those patients. So with those two situations, it was attached to an online service that is being posed and offered within this state that I'm curious as to see how we're going to address. But when I broke it down to the retailers that how many of our clients or patients that we see are actually medical endorsed, we gave a number and it was so fractionally small that then they got to understand that the savings and the impact, and it's just not there. That fear is not actually being seen with what's happening.
Charlotte, you bring up something that I think others had been talking about, which is, again, this sort of online or quick to get authorization. And I think there's scam and clickbait in any place or in anywhere that you're trying to get something official. But that's not something that gratefully, you can affirm you're not seeing in high numbers, or at least has been a larger concern than I think already maybe has been or could have been. I'm a former registered MCC myself. And, I think the times that I would need to deny a card was because it was maybe on the wrong paper, or maybe the doctors themselves hadn't updated the form. And so might be going a little off the plan, but maybe we can pitch to DOH, some of the support and resources that you have when, forms are updated, or, information needs to make it out to these folks that are writing the authorization forms before it even gets to one of our MCCs. What does some of that look like and sound like? Lorelei.
Sure, I can start us off here. The first thought I had to the question is something we're doing more in response directly to 1453, and that has to do with communicating out to healthcare providers that are able to authorize use of medical cannabis, reminding them of what's required by law in order for them to provide authorization. So I've worked with my colleagues, other program managers that work with those boards and commissions, with the Washington Medical Commission for MDs and PAs, Osteopathic Board, Naturopathy, Nursing Board. And we sent out a communication to them, sort of giving the context and background for 1453, that they may see more interest from potential patients, and just a reminder of what their obligations are, and links to our website and our guidance docs, those sort of things about finding the form, the authorization guidelines that those boards and commissions adopted. So that's one thing that we've done.
I'll hop in now. We definitely hear you guys in regards to those online companies trying to help, get, quote unquote, easy access to your medical card. Like, I completely understand why these companies are there. There's still a lot of, there can still be stigma amongst providers and physicians about even giving somebody a medical cannabis authorization form and even going down that route. That's kind of why these companies formed in the first place. The problem a lot of times, and we have seen a bit of an uptick on our side as well, complaints about, from MCCs questioning these not valid forms because they weren't printed on the right paper or whatever the reason may be. A lot of times it's because they're from these online companies who haven't actually seen the person in person in their physical office, which is what's required for an initial visit. We're looking at updating our authorization form to make it a little more clear for the prescriber or physician that is giving that authorization to the patient, so that if some physician who's actually out of state working for one of these online retailers or online authorization folks, that it's very clear in this little checkbox that you saw them in person. It puts a lot more onus and clarification on the form, a lot more onus on the prescriber who's giving that authorization for as well. So long story short, we hear you. We are looking at updates for the form to make it a little more streamlined and easier for physicians that are looking to give these cards out.
Thank you both for that background. It's great to hear that while we're moving in support for the patient, as are you all. TJ or someone from DOH, could you tell us what that looks like? How often are those forms looked at or revisited? What's the process to change something like that? And is that ever something that community like ours, had the opportunity to offer more light to?
I don't want to dominate too much. I'm kind of thinking, Shannon, I don't know if you want to jump in, but one example that I can think of in particular for the authorization form, when we had the town hall meeting in December, which was kind of a big kickoff of our program, partnering with the Alliance and having that broader conversation. An example of that came up was concern from the patient community of why are all of the qualifying conditions listed on that authorization form, and then that's checked off and that's getting entered into the database. Why is that necessary? I don't, for, a lot of reasons, not comfortable with that, and how is that appropriate? And so we've taken that back to the team and really scrutinized and said, okay, well, is law requiring us to do this? We know we're not finding that, but we have it in our rule. And so let's research the history. We're a fairly new team in these last years. Let's research the history and see if we can understand the rationale for requiring that. If not, so, we ask the question, well, why would we use that data, like in aggregate form? What would we use that data for to inform us to make different decisions? And until we can really have a good rationale for that, we're looking at doing a rule change on that to enable us to change that form in response to that. So, one example.
Thank you.
Yeah, and I can piggyback on that a little bit. So with any type of form or document, there's always a review process that occurs. And you always, with updating forms and information, it needs to make sure that it's in alignment with the rules and statutes, which Lorelei just gave a really great example as to we have a current rule as to why this form has to have it on there. And then going through the process of what that would look like to change and make any alterations to it. The other piece that we always like to consider is when forms or documents are updated, who all needs to be informed, alerted to those changes, making sure that we're connecting with all the impacted parties, making sure, like, if the authorization form is updated, that we are finding ways to get that information to the healthcare providers who have to have it printed on a certain type of paper. And so there's a lot of just trying to make sure that everybody is kept in the loop as to who's impacted. So that way it's not just a standalone document that's changed, but then this other person that uses it regularly isn't aware of it. So that's always in consideration as well. And then I think sometimes we have this really amazing guidance document for healthcare providers that's available on our website. And that was created a couple years ago through work between the programs. And I think a lot of times it's just not known what resources are available or where to find them. And so really trying to utilize things like newsletters, communications to help navigate people to those resources that do exist.
And I'll throw on real quick, as per, there's data to be had, the qualifying conditions on an authorization form, just to give an example of data to be had, there may be an ask or that comes our way that says, hey, what percentage of medical cannabis patients are using it for multiple sclerosis? What percentage are using for, cancer-related pain? So, when these things get entered into the system, that sort of aggregate data can be very easily produced for the interested parties. And gives us a nice snapshot as well as to what the makeup is of the medical community.
Thank you. With the forms being updated and all of that communication, we appreciate you all partnering with organizations like the Alliance as well to do things like this, to remind folks of where those resources are and get them to them. So thank you very much for enlightening us on that. I wanted to just highlight and affirm before we move too far from authorization and DOH that there hasn't been any change to how that process works. So 1453 didn't usher any change there. We're just kind of reaffirming and going down that resource path of what that looks like and how to make some change. So let's talk a little bit about what patients can actually save on now with this excise or tax, right? The 37% removed, and that would be DOH compliant products. There's not many on the market, but they are meant for folks who want to have a higher confidence in what products that they're using, that they're safe, that they've been tested. I'd like to start with Angela. If you could talk a little bit about the work that Skagit's been doing, before it was cool to be DOH compliant, and tell us a little bit about what that product looks like.
Okay, so you are correct. I believe it's been 2 years now so we have many, many, many products. We're most well known for our RSO original whole plant extract. So that whole line, THC, CBD, and CBG, that line has been DOH compliant, I believe, for 2 years. Then the rest of our products, so our platinums, our distillate, our vape carts, our topicals, our cooking oils, our space weed, all that stuff has been approximately a year. So Yeah, it's just we've always been super aware of what we call patient safety. Being patients is that we wouldn't be here without the patient community, right? So for us, it was just paramount that we stayed true to that. And so, yeah, I mean, the other two companies that we just absolutely adore, Trailblazing and Fairwinds, shout out to those guys. Trailblazing, and both of them did it long before we did. So I have to say that they're awesome. Yay. And then also just to see the other companies jumping on board. That was the plan. That was the hope, right? That everyone would go, okay, we all can do this, and we can, because Skagit, we're not a big company, but we have huge hearts, as cheesy as that sounds. So I'm just super proud of us as a team and just everything that is coming true. Yeah, I'm excited.
Thank you. And then Charlotte, maybe you could tell us a little bit about some of the products, the DOH products that, are the go-tos for y'all in your shop, or that patients, have been asking for again long before, but hopefully, now with 1453.
Gotcha. I think, I know Skagit is in our shop when we sell it, so yay. But Washington Bud Co. is DOH compliant. And then I found out I've seen several different notices that have come out of products that we carry that are going DOH compliant, the largest being Grow Op or Fat Panda. And anyone within the industry knowing all of their entire product line going DOH compliant is a chain, Sven Gardens. And so I think that covers a large market of the Washington State dispensaries when you think about those producer processors.
Thank you. Even kind of going into some of those that are jumping on board. Angela, you might have a thought there.
Sorry. Yes. So if you go to Certified with Confidence, they now changed it. I believe it's medical grade Certified with Confidence. There, I just checked it this morning. I'm always on there, but it started out with 30 brands. And started with 6, and now there's 24 new ones on there. So these are all growers, producer processors that have stated that at least 60% of their product lines will be DOH. So that is so exciting.
Thank you. Yes, and very exciting. And while those numbers are exciting for us because we recognize, again, who has access to those products, I want to just make very clear for those watching and learning with us that this doesn't mean that everyone's rushing out to go and get that product with saving 37%. It is just those medical patients, and not only that, but those that are registered in the state database, in the medical database. And so, that's a fraction of the actual market that's out shopping, but it just means that fraction is being served, more purposefully and with products that are safe for them. So thank you both for your input on that. I wanted to just briefly touch back because we had a question in the chat about maybe DOH can take some of this, but where do you get the form, the medical authorization form? And is there a document that I can give my doctor explaining the process? So maybe not a doc, but I know Shannon, you had mentioned, you have things on your website. Is there maybe a link you could drop in the chat and we could share further with our people online?
Yeah, we can submit the link. So the form is actually received from the healthcare practitioner. And so the healthcare practitioner will have access to the form. They'll print it on that tamper-resistant paperwork to then hand to the patient. But we can put in the chat the link just so you can see what the form looks like, an example of the form, which we have on our website, as well as the guidance document that the doctors, we share with them. Lorelai is already putting it into the chat. The guidance document that we share with the healthcare providers so that they can see how to complete the form, what information is needed in the process. Thank you, Lorelai.
Yeah, that link is to our main healthcare practitioner page, and it's kind of broken down into sort of an overview, goes into around requirements for tamper-resistant paper, the logo that's needed, then links to those guidelines we've been talking about.
Thank you. All right. I want to circle back to our MCCs a bit and discuss a little bit more about, we talked about the DOH compliant products that patients are eligible to save on. What does that sort of conversation sound like when you're talking to patients, whether they're renewing their cards or maybe they're new to the database? How do you sell DOH compliant product, right? What is the talking points there? If either Angela or Charlotte would like to put in.
I'm happy to jump in this situation, but I'll be honest, I've yet to have a patient with a medically endorsed card ask me for a DOH compliant product. So it hasn't happened yet. And thus far, my conversation has been more on the educational standpoint of, hey, do you have one of the qualifying diagnoses? Have you heard of our medical registration process, our medical cannabis process in the state of Washington? And once I get that going, I let them know, hey, 1453 happened, then there are products that you could be saving taxes on. But it's like, I find it that my education's at ground zero, not even dealing with many patients. Like I said, we have about 10 to 12,
Thank you, Charlotte. Yeah, and that just kind of speaks to, again, the fraction of these folks that I think when you're a smaller piece of the pie, you can get forgotten. And so I think that's, again, a testament to people aren't rushing into the stores. Thanks for busting some myths with us today on some of that, because folks are concerned. Angela, what about you? When y'all are formulating products over there at Skagit, you mentioned being patient focused. What are some of your longtime patients, looking for, or do you feel like your product lineup has reached what they've needed?
Yes. We're always looking for other things, like CBN is coming down and CBC. There's all those talks, right, of the other cannabinoids. But for us, it's just always been about just a clean product, right? So if I'm working with a patient and sometimes our product isn't what I would recommend for them because they're just not there yet. This is a very, concentrated oil. So that's when I would go to like a Fairwinds product, something that I know is clean, is, medical grade, if you will. And that's essentially how I sell it. I wouldn't sell something or recommend something that I wouldn't ingest myself or recommend that my mom or sisters ingest. And so for me, it's going to be quality and cleanliness over anything. And just, teaching them how to read a barcode is very important to me. I know that sounds kind of funny, but there's so much information on those barcodes. And so, it can also tell you too, for the patient, what also can work for them. So if that product's not available, if they take a picture of that barcode, then they can find something that is the next best thing for them until that product comes back into the store. Right. So it's education is key. And I hope that answered your question.
It does. And it makes me think of, and Charlotte, I see ya. It makes me think as well about how this medicine is also agriculture and how it takes time to create these medicines, right? Time to grow these things into the products that the customer needs. And so having more DOH compliant products only makes sure that they have something available when, their go-to medicine isn't available, because it takes time. Charlotte, you have some thoughts?
I just wanted to add on to what Angela was saying. Like, I think the most important part is that first she finds a product that works for the patient, like meets the patient's needs. What are those needs? That's the conversation that you should open up with. And then you can work your way in to explaining what a DOH compliant product is, and then the ones that meet that criteria and why that has value to them as a consumer or a patient. But if you don't first find what they need, then you're doing them a disservice.
And to your point there as well, Charlotte, I mean, that's just a lot of expertise just rolling off. And that is the sort of care that folks that are registered in the database get, because they get to talk to medical cannabis consultants who are registered with the state, who have a higher level of knowledge to have those sort of consultative conversations. Because I feel like to right fit a product, you have to be really curious and ask questions and kind of join the patient on a journey. And that is a lot. That sounds like a great thing, but at the end of that, you want to find something that really matches what they're looking for, and again is safe and effective. And so I think you really hit that point really well. One of the things that I wanted to, we have a question from the chat. So before I pivot a little bit, the question is, will the state be making a compliant list of stores and producers? DOH, do you happen to have any insight on any tools that might be existing? And then maybe I can chime in from the Alliance as well.
Kind of looking at you, Shannon. I think you might be the best one to field this.
No worries. So we actually have on our website a list of medically endorsed retailers. That list is updated every week, and it's a list that we get directly from the Liquor and Cannabis Board. And so we go and we update if endorsement's been added or removed, and it's updated weekly. So we can put that link in the chat as well, so you can have access to it. From producer processor standpoint, DOH doesn't have any type of list of producers or processors that is creating or making DOH medical product at this time. I'm not quite sure if LCB has a list that is available for producer processors. I know that on their website they have the retailers. But in terms of at least medically endorsed retailers, that is something we update on our site, so that way people can see who is endorsed. We always encourage patients who have received a medical authorization form to call the store before visiting, just to make sure that there's a consultant available at the time that they're planning to go, and to kind of have that discussion. That way, if they do have to drive to the store, they're not driving for naught. They're driving because they've already connected. So we do encourage that as well.
Yeah, Shannon, that brings up something that I've seen and heard before, which is, to be medically endorsed, you only need one consultant on staff, and that person's not going to be there all the time. And so kind of the bar for what medically endorsed has been kind of low. I feel like this sort of additional kind of layer and hoops that you have to go through to make sure that you have products for them that are DOH compliant, that, it's set up in the systems to sell properly for the retailer. It's a little extra lift, but it's a lift again to hopefully to serve the patient better. Charlotte or Angela, does that bring up anything for you around? Charlotte.
Well, I guess my question would be in serving patients better. What I find a lot of times I'm being asked is, where can they find a designated provider? That might be the wrong term, but where can they go find a practitioner that is qualified to do these authorizations? And as a retailer, we are not allowed to point them at one person directly. And so my question for that is there something on the DOH website that they, these are a list of practitioners under this category, you can take it from there? Is that allowed?
Yeah, Laura.
This is a question that comes up quite a bit, Lotta, and we just don't. We don't. I don't even know if we would be able to get that data if we wanted to. Really, the best guidance we can give to folks that are looking to find a healthcare provider is to reach out to their primary to see if they have any ideas. It's reach out to the community, but as a state department, we just don't. I know we came across some kind of data from the past before any of us on the team now about kind of which providers, like by naturopath, MD, ARNP, that kind of thing, tended to authorize more. And I think we can only say anecdotally, and we've heard from others as well, that naturopaths maybe, tend to authorize more. But beyond that, we just don't have access to that data, or we don't have it available. And I'm not sure, if it is available anywhere.
Yeah. And I wanted to just note, TJ, your comment that you put in the chat. I really appreciate, again, the why of why these online, spaces have turned out. I'll turn it over to you.
It goes back to that stigma about it, let's make up a number and say 50 to 60% of docs are uncomfortable providing medical cannabis authorizations. And that create, like, if that's your doctor, then where do you go from there? You could hop around from place to place, hoping that this person is open to medical cannabis as a medication. But, again, this is why those companies online have started up to, open up the access to patients to get their cards. Like, I understand why they're there. They just need to operate within each state's regulatory structures, really.
Right. And we, again, here at the Alliance are trying to support a sustainable industry. And that does mean that we need to work with and around and help create the change that we want to see in the regulatory structure and in these frameworks that we're creating for patients, and make sure that they work better for them. So thank you all for being a part of that conversation here today. I wanted to discuss one step further, just to clarify, we're kind of halfway through our conversation, but I wanted to affirm again, really the process for this to be true, right? In order to go and collect 200, which would be, doing all these steps to be a patient, go into the database and get that 37% excise tax. In order for that to be true, the store has to be medically endorsed. You have to work with a medical cannabis consultant or bud tender to purchase only those products. And if all of those things are true, then again, you save on that 37%. So just checking in for those maybe that have joined us late, what 1453 is doing and what makes that true in order for you to be eligible for that. So we have a question in the chat. Best served for Lotta and Angela. It is, what is the process or requirements to be an MCC? Could you share, just for education purposes, what that process looked like and was for you?
Yeah, I can take that one. So you essentially have to do a course. I believe it's 20 hours. You can do it through the MMJ Institute, which I believe is in Linwood. I think some of their stuff is still available, classes online, or the Academy of Cannabis Science. They're awesome. But yeah, you go through that. You have to get your CPR card as well, and then pay for your license. So the whole thing is about $500 or so. And then you have to do 10 hours of CE continuing education every year with an approved group. So like the Academy of Cannabis Science and the MMJ Institute, you can pay for courses and that will equal, your 10 hours of CE. Your license is only good for, I believe, a year. It expires on your birthday. So you have to have all that stuff ready, all your CE available should the Department of Health want to verify that. And then keeping up with your CPR courses and all that stuff. But yeah, it's I highly recommend doing it, even if you're not in the industry, just overall education. It is absolutely phenomenal. So big fan of that. And to be fair, I hope that there are more educational outlets that become approved for CE, because I know myself, I use all different things and they are absolutely phenomenal, but they just don't count. So that's it.
Can I make a quick note on the ones that don't count? Because, do you mind? Is that okay? Right?
No, please. Yeah, absolutely.
Because this also came up at the December Alliance call, and I know someone brought up that same thing, that a lot of things don't count. So that's something maybe just to look into a little bit more. The person that said that thought that they were limited to, and now I wanted to mention also, we now have 3 training providers.
I think the third is MM411 still.
We have recently, my mouse is not working, Green Culture ED, I believe is how they say their name. I don't know why I can't navigate here. I don't know. I can't scroll down the page, but of that link that I shared, if you look at the link that I shared and the left-hand sidebar, you can click on training programs, and at the bottom of that page, see the approved training programs. But back to approved CE, I think the thought with this person was that only those 20-hour certified training programs are the ones authorized to give CE. That's actually not true. Our continuing education rules are broader than that. And I think we need to put together more information for our webpage that kind of clarifies that. We might have tried to do a little bit of that in response. But yeah, that's something that came up. I think the allowed courses are broader, maybe broader than a lot of folks think. So we can talk about that more at some point. But yeah,
thank you. Great conversations. All ways to make MCCs not only the process, but the experience, one that's fulfilling and that really can serve the patient even better. So Laura, that's really great to hear that there's an opportunity to discuss, hey, does this thing work? Can this be considered CE? Especially because the cannabis industry is still so, especially the regulated industry is so far in its infancy still that, we're creating a lot of the playbook as we go, and, a lot of it should count. And so that's really great to know. All right. I think we've answered our questions in the chat so far, but I wanted to just check in with the room. What has been the main talking point 1453 has ushered into your day-to-day life? We know, again, it's the result is that removal of the excise tax, but for you in DOH, has it been, again, the forms, or is there changes to registration? And for MCCs, again, what has been the biggest talking point? I'd love to hear from anyone in the room. If you'll unmute when you're ready. Johnny.
So one thing that comes up on the testing side that is becoming more critical now is that we have to maintain identities of batches that are transferring between producers and processors. At the moment, the onus is on the retailers to maintain these detailed records to prove tax compliance. And the way the system is working now, it's actually not a really straightforward thing for something that there really should be a straightforward thing for. And so I know that's going to cause a lot of confusion, and that's going to take some time for it to iron out.
Yes. And I want to just acknowledge that there's been some public feedback sessions about some of the rulemaking and things like that around that. But it is only the time for rules has only been extended by a month, even further out into October. So, Johnny, I know that has been a frustration, for folks who are navigating that space. Can you tell me a little bit about, or have you heard anything about any sort of solutions or creative solutions that folks are coming up with to make that work now and do that sooner?
Yeah, because these really are systemic, ingrained issues. A lot of it comes down to mundane tasks that are repetitive but are critical. And a lot of these systems that are in place, just in terms of regular record keeping, is not well suited for an industry that is quickly evolving. And so there is talks on switching from one system to another, but there is no perfect system out there. Everyone has their shortcomings, and there is still plenty of room for improvement, and we are still having these discussions.
Yeah, still building the playbook, like we said, as you go. Thank you for bringing that up. Johnny or Angela, I know two different worlds, but both talking testing. Anything else that maybe you could share with us about what the testing process is like in order to be DOH compliant, or, any other learning that we might have for the group here?
I'll let you start, Angela, if you want. I think keep going.
Well, it's a lot simpler on my side. We just do extra testing. I mean, we check the extra boxes and we pay the extra fees, and that's pretty much it. I mean, we work with some absolutely amazing partners that, feel the same way we do. So it makes it easy. When everyone works together, it's amazing what can be accomplished, right? So yeah, I wish it were more complex, but honestly, it's just literally checking the extra boxes, making sure that we say, please check for the following things. And that's it. So Johnny, I think you can answer it way, way better than I can.
So there is, at the moment, there's only the difference between the heavy metal testing and the sampling size requirements. It's a little bit different. But you're right. Once you get a system down, you can just check the box. There is some confusion early on because it's not immediately obvious what is the box that is necessary. So a lot of these can be solved through communicating and just working it out as you go along. But the DOH program, it does maintain the ability to ask for different test in the future. Currently, it's only they have a metals test, but in the future, there may be a time where if issues come up quickly that we may be more flexible in implementing rules for patients that are a little bit more specific to patients and doesn't have to be completely encompassing of the entire market. So it just gives us a bit more flexibility in the future.
Awesome.
That's
Thank
probably
you.
good for just a quick mention. If folks don't know, we have that entire WAC chapter, that chapter of rules on our product compliance open right now. We've been working on that for the last 6-9 months. We have another public workshop on that coming up. And that is on the quality assurance standards. So different testing. So we are looking at exactly what Johnny was talking about. Right now, heavy metals, do we want to look at stricter action levels for that? Do we want to look at terpenes? We're talking about all of that stuff right now in this rule revision.
Got it. And Lorelei, is that already scheduled? I know you just planted a lot of seeds for people watching that in our membership that would want to be a part of that.
Yes, it is July 18th. And I'm thinking the best way, if you're not signed up for for our Gov Delivery list, so we use the platform Gov Delivery for our communications out via email. We have one that is a program, the broadest level. We've got about 5,600 subscribers in that. So I will try to find the most, it's signing up is a little not real straightforward, but I'll try to drop a link in the chat where to go to sign up for that list and some little clues about what boxes, how to scroll down and get to the right box to be on that Gov Delivery list.
Thank you. And I saw you drop a link on how to be medically compliant. That is super helpful for any folks watching, again, in our membership that are, maybe interested in becoming medically compliant. So TJ, anything else to add on that link?
Yeah, heavy metals got brought up, and I'm happy Johnny also mentioned the sampling. I just want to be clear that LCB and DOH do have different sampling protocols for the amount of sample that needs to get submitted to the lab. LCB, I think it's up to about 8 pounds or so of sample is where the delineation kind of is. After 8-10 pounds or so, DOH requires basically an incrementally more sample as you get up to like 50 pounds. So you do need to sample a little bit more of the product before sending it into the laboratory. It's basically a bit of a more representative sample of the whole lot or of the harvest. But that does need to be followed now. And, as was mentioned, there's a lot of stuff in our rule set that we're looking to edit, change, merge. Sampling protocols, us being so different from LCB, is one of those things that we're looking at to try and streamline things and make it a little more streamlined and easier for producer processors to, maintain compliance in either or.
Got it. Thank you. And, all of these conversations, while 1453 maybe isn't in them, that's exactly what this convo was meant to be, is decoding, all these different areas. Johnny, when you started talking about testing, I was like, gosh, from like who grows the plant to then who puts it in the package to then who tests it to all these things, all these people working together to get a safe product for the patient. That's a pretty great thing that Washington is trying to do for the medical community. So thank you all for being a part of that team who's making that happen. It ends up in places like, a lot of stores like yours that are serving, the customer and the patient. Can you just tell me a little bit about what that patient experience is like? You're an MCC and we had some questions from the chat about how to do that process. So what does that look like once they get into the store? Could you walk us through that a bit and, to them saving the tax?
Absolutely. For us, it's pretty simple. First you have to have a medical endorsement card, and that has to be verified by a staff member that is set up in the SAW system. And so you can take the card number, you can verify it. Okay, so the card is valid. Then there's product selection at that point in time. Say they chose a Washington Bud Co. 8th. For me, I just got to scan it. We have tagging. We use Posibit, and there's Greenbits. There's a couple other programs used for sales in dispensaries, but there's coding, and so they'd look underneath it. It'd be a medical patient, and when they scan it, that 37% savings would be present and they just pay their price. Now, what I'm seeing on the back end for the retailers is just the record keeping. Like we can get to that part, we can sell it to them discounted rate, but the data and the information that we then need to maintain compliant, that's the piece that we are struggling with these systems that are being used to track sales.
Yes, and just to acknowledge that, unfortunately, without a solution, because we're in the same boat, the industry, I think, as a whole, and retailers are asking a lot of questions curiously to make sure that they're in alignment with regulation and making sure that they're doing what they need, but also protecting patient privacy and data, right? It's a really interesting space that, again, all these people are touching things that are serving a patient, which at the end of the day is a very private thing to be. So thank you for bringing that up. Again, unfortunately, we have like 9 minutes left. We will not come up with the solution together today, but happy to ask more questions to add to the list for us as we continue to do this work collectively. So thank you for that input there. Anyone else have any, lasting thoughts or things that have come up about 1453? Charlotte, did you have another? Yeah,
I did. I forgot to ask the question, which I've seen maybe some, I guess, confusion on the retailer side. When this, and maybe it's the implementation of the bill, and I'm hoping someone can explain it. So the 37% gets saved to the patient. Does the retailer get a deduction when they pay taxes to the Liquor and Cannabis Board? Or does that just what happens? Do they just take that loss? And is that a choice that they're choosing by serving medically endorsed patients? I'm just confused about it,
Yeah,
yeah, go ahead.
That's a great question. From my understanding, it's just a tax that, again, is just not collected, right? So really the state is doing the favor to the patient, right? We're all doing the right thing by passing that legislation to remove the need for them to pay that tax. And then the retailer is just making sure that that's done effectively. The reason retailers, I think, are concerned or frustrated or any of those words is because if they don't do that properly, they would have to pay that tax, right? Say you scan something at your retailer that wasn't DOH compliant, or there was a tag mismatched in POSIBIT, then that might be an area where the retailer has to go back and pay that tax that should have been collected on that product to the patient or customer. So thank you for asking that question. I think that's really important to make clear for everyone that, again, we as a state are trying to do right by the patient, and the retailers do have a big lift here. A lot of support and conversation has been going around to them and from them, about what that looks like and how to get that going. And I know that there's also an integrators group that's, trying to work on what that looks like in POSIBIT and green bits and all those things. So really great question on that. Few minutes left, everyone. I just wondered again, any other kind of lasting thoughts on 1453 or any interesting topic conversations that it's brought up, whether they, any other myths we can bust together on this update. Okay, great. I'm just going to check the chat here real quick and make sure that we've answered all the questions. And Jill, I think we are good. So once again, for anybody watching and tuning in, a big thank you for joining us and having another conversation, one of hopefully many, around this change, 1453, and eliminating the excise tax for patients in the state database. It has been a pleasure to have those of you from the DOH here today to help us. Thank you for being a partner in educating our community today. And a big, big thank you to Angela and Lotta for being MCCs who are supporting the patients and having those conversations day to day. So thank you all on behalf of the Cannabis Alliance. We appreciate it. Once again, we're dedicated to the advancement of a vital, ethical, equitable, and sustainable cannabis industry. And we hope to see you at our next webinar. Thanks, everyone.